Welcome to an informational video from Fletcher United Methodist Church with responses of two of our community's medical professionals. I am Randy Sherrill, the teaching pastor at this church. Our congregation is very concerned about the safety and health of not only our church family, but also the community at large. Since March the 16th, we have suspended all in-person gatherings of more than 10 people, including our worship services. We are operating under the guidance of our resident bishop and Governor Cooper, and will not resume in-person indoor gatherings until we are sure that we can provide a safe environment by meeting and exceeding the protocols expected of us. These two medical professionals who have given their time today will not be identified unless they choose to do so, because of HIPAA privacy and because they're offering their responses in the public interest and not in any way representing the institutions or practices where they work. Yet both of these professionals have been on the front line of the COVID-19 response. I want to thank you for your time and expertise. So if you would begin by telling us how long each of you have been in the medical field, including all of your academic preparation and active practice, including the area of your specialty.
Okay. Thank you, Randy. And I'm Dr. Michael Stalford, and I work at Advent Health, Hendersonville. I did my pre-medical training at Cornell for 4 years, and then went to medical school at the University of Virginia. I was in the military, and I trained at Walter Reed doing otolaryngology, head and neck surgery, ear, nose, throat surgery. And it's been 8 years at Fort Campbell with the 101st Airborne, and then for the past 14 years, I've worked with Advent Health Hendersonville, formerly known as Park Ridge Hospital.
Okay, I'm Stacy Jackson. I have been a nurse for 23 years and have specialized in ICU for adults the past 21 years. I'm currently working at Advent Health also for the last 7 years, and previous to that I was at Mission Hospitals for 13 years. I went to East Carolina University and got my Bachelor's of Science of Nursing there, and have been doing critical care most of my career.
Thank you. So especially today, as Governor Cooper has announced that we're moving into phase 2 this Friday, what are your primary concerns as we move into phases 2 and 3 of lesser restrictions?
I'm concerned that people are not going to stay home when they need to stay home. I feel that if you are not feeling well, or if you know you have a fever, or you know you don't feel well, you should stay at home. I think that's the biggest thing. I think we rely on each other to make the right decisions, but that's not always the case. That's not always what happens. And so I'm just worried about that, the majority that aren't taking it seriously, and the people that are out in public now without masks. And you know, it's not just the younger, I used to think it was the younger group of folks that are out there doing that, but I'm seeing people that I could look at them and see that they're high risk. They're not protecting themselves. So that's my fear, that people are not going to protect themselves and others by staying home.
Yeah, and exactly. And I would say right now we've done such a good job at flattening the curve by shutting down. We know that's not going to last forever. We're starting to open businesses. We're looking at opening churches, etc. The disease prevalence, the percentage of the population that has this virus in this area, because we did such a great job, is still very low. It is only going to increase as we open up, so we really need to do this safely. Looking at a vaccine, we're probably still 18 months or longer away from a vaccine to get to the point where the amount of virus in the population is going to be is going to decrease. So we expect it to increase. This needs to be a slow, safe progression. And that is what's critical to protecting the population that is at higher risk for developing severe disease from this virus. So that's really my biggest concern. It's low now, it has to increase, And we have to do this slowly and safely to protect the people that are at highest risk.
All right. Governor Cooper's team, led by Dr. Mandy Cohen, has given us 3 simple guidelines that I think all of us can follow. Wear, which means protective face coverings of some kind. Wait, keep at least 6 feet distance when we're in any public setting, and repeatedly wash our hands throughout the day or use good quality hand sanitizer, especially following being in public or touching surfaces outside your residence. How important are these 3 things?
Yeah, and they're critical. Wear, wait, and wash. That just has to be something that just comes off, our thought process when we are outside and not in our home anymore. Wearing a mask is protecting others from you. When you wear a mask, you're thinking of others, and that's critical to understand. And then waiting 6 feet away, you're protecting yourself from the person next to you, in front of you, in line, at angles, etc. And then washing your hand, that's the last line of defense. You may wait 6 feet, you may both have a mask on, but if someone nearby is breathing and those droplets are touching something that you touch, even though you did wear and wait, it has to go through your eyes, nose, and mouth to actually affect you. So that's the last line of defense. So those 3 things, absolutely critical.
All right.
I think, hand washing is the most important way to prevent any kind of infection before this virus even came about. I think that people have, sadly, I was thinking it was kind of common knowledge before, but hopefully now they know that they're supposed to be washing their hands. I agree with everything Dr. Salford says. I think to expand on that is, keep your hands off your face. Your hands touch everything. And, I've seen people in the grocery stores with gloves on, which is ridiculous, because they're touching everything that they touch, and then they're touching food, and then people come behind them and they touch the food. It's something that is so utterly important to stress, is the hand washing, and keep your hands off your face. That's the only thing I would add to that.
Yeah,
all right.
Thank you. Good point.
All right, since both of you are part of our faith community, as we and other churches are considering regathering in person, what do you most want us as leaders to emphasize as we get ready for that?
As I said before, I think the biggest thing is to tell people if they're not feeling well, stay home. That's the biggest thing that we can do for each other. I think that's the most important thing. Just stay at home if you don't feel well.
All right.
Yeah, and I would say, in addition, the world's watching. Not just faith communities, but how businesses are opening up. People are watching, but I think it's especially important that we provide a good example. And I would say it's an example of faith to say God has put experts and people in our lives, and respecting what they're saying, doing it with grace and humility, and trusting. That's where faith comes along. And then they're also watching, we're acting in love by doing these things of wear, wait, and wash, because we're not just thinking about ourselves, we're actually thinking of others. So just emphasizing that within the faith community, faith and love, that's part of it.
And as you represent a number of folks in our congregation and many in our community and nation and world, how can our faith community and others best support and appreciate you during this time? Because not only are you professionals, but you are human beings that have the same emotions we do. How can we help you?
Well, by what you're doing now, communication, bringing us in to help plan and execute safe and slow reopening, protecting those that are at risk, and having us involved. And being a good example that can be emulated and repeated. Churches that open up and are doing well and not having cases, those things that we're doing will be emulated, will be copied. So setting a good example and communicating with us just like you're doing.
Mm-hmm.
As people of faith, I think that we should pray for one another. pray for our country. We are so blessed to be in an area that's not densely populated. So we're not seeing the numbers that, New York City and Chicago and the bigger cities are seeing. So be grateful, get on your knees and pray and just be grateful for what we have here in this beautiful area that we're not inundated like a lot of places are. And then just pray for our EMS workers, our doctors and nurses, and everybody who are taking care of these patients. That's all I ask.
Amen.
All right. Again, thank you for your time and heroic efforts on behalf of all of the public health interests. And I want to emphasize to all of our viewers that you receive and value your information from solidly reputable sources. And to understand that these professionals have echoed that the actions you take or avoid not only may endanger or save your life, but will also affect the lives of those you love. So to all of those who are watching, be safe, be well, and be wise.